I'm Kate Lundgren, and I have the privilege of being the mom of two very special young men. My oldest son, Trent, is now 21 years old, and he has Asperger's syndrome. And then my baby, Spencer, who's not much of a baby, is 17, going to be 18 this next March, and he has PDD-NOS. And these boys have taken me on a great journey in my life, and at this end of it I can see all the great things that have happened, but at the other end of it, it looked very dark and bleak. But I can tell you it's not. Great things will happen. But I started this journey many years ago when the autism community was very different. I've always been an OT. I was an OT before my kids were diagnosed, and I worked with adults doing stroke, spinal cord, and brain injury. And then when I moved to the great state of Texas, I had the honor of changing my field of practice to focus more on pediatrics, which, by the way, I said I never do when I was in OT school. So don't ever say never, because you just might be there. So I did, and I had the privilege of working for Allen ISD, and that was a great learning experience. And then I had an opportunity to work in private practice and learn the sensory integration route and learn about modulation disorders and all kinds of fun coordination things that our kids have trouble with. I've worked with, I would say, maybe 50 to 60% of my caseload, almost up to 75, are kids that are somewhere on the autism spectrum. But I think the greatest thing about being an OT was the fact that I got to create the most amazing home program in the world for my boys. I was able to actually take my field and apply it in the house. And many of you have been able to see the Lundgren Learning Center that has ADL schedules and, you know, picture schedules that do forward and backward chaining, and it's just been a really neat experience. And I've had the opportunity to train a lot of students that are now in the healthcare profession, and that's been a real privilege. I've had the opportunity to be an adjunct professor at Texas Women's University and really be able to bring autism into their curriculum. I created a special interest course on autism spectrum disorders, and that's been really a lot of fun. But my last and final venture has been Cutting Edge Pediatric Therapy behind me. And this is probably my biggest vision and biggest passion that I wanted to do, because I was the parent that sat in the waiting room. I spent most of my life in waiting rooms. And I think the most cathartic thing was to be the OT that sat in the OT waiting room. Try that one on for size. It's kind of interesting. But what I wanted to do with Cutting Edge was create the best practice I could for the clients and for the parents. I wanted to have the best waiting room where y'all could relax, have a Diet Coke, have a cup of coffee, and also have the resources available for you to use. And I've had the opportunity to do that. We created the most amazing gym in the world, and we're actually looking at expanding. So I really feel like I've been able to contribute something to the community overall to help our very special kids.